What's going on, guys? Welcome back to your MPRX programming. We're in a new video for a new day and some advancement in the techniques. So today we're going to use our band to help advance from our ShinBox position, okay? Now, if you remember, our ShinBox position is this guy, right? And our rotational component to that is this. So what we're going to do is we're going to use the band to really help this position add some assisted pull into our rotation. And what we're going to do is be able to use some assisted PNF, or basically contraction of the muscle and then relaxation of the muscle. So I've got the band. Anchor that guy just right at the wrist, okay? Just right around the wrist, and gently hold on to that. So now I've got the band. It wants to pull me this way. That's what I'm going to let it do. Set yourself in your position, plant that left arm, and what I'm going to do is I feel a stretch already right through the back of my shoulder, and I'm just going to let this band pull me. Okay? I can shift myself out even further, and the band is going to do the work for me. So in the last one we were actively reaching away. Now I'm just letting the band pull me away. All right? And then from this stretch component, we're just going to pull ourselves back and then let ourselves rotate away again. So this is that movement. It's just a nice back and forth. Posture myself up. Full stretch through the whole arm line. Stretch through the rotation of your spine, of that spiral line. Pulling back and relaxing. I'll switch bands, okay? So I've got the low band, and if I'm able to drop myself lower, that's gonna pull me differently from a different angle, okay? And now I'm just gonna posture up and pull away and relax. Drop the elbow, lean forward. Posture up. Rotate, relax, release. All right, so that's ShinBox with the band. Now, as we progress for the ShinBox and the hip movement, remember, front leg is an external rotation, back leg is an internal rotation. Depending on what your body mechanics are normally used to, one is going to feel better than the other. So my internal rotation feels tighter on this hip, okay? My external feels okay. So what we're going to do is try to focus on keeping the feet down and shifting into the position. So I'm using my core. I'm going to collapse in and shift my position. All right, so if we're here, I'm going to open and shift. I can add this rotational component. Open, shift, plant, reach. Open, shift, plant, and reach. Okay? Now we're going to add open, shift, plant, reach, and extend at the same time. So now we're really opening from ShinBox into more of that pigeon position, okay? As I reach, I'm still trying to keep myself down on my glute on this front leg. We're going to close together. Rotate, shift, plant, open as I reach. We're combining that full fascial net. Okay? This is the challenging part for people. This back and forth. Keeping the feet down and shifting. Right? Again, boom. Boom. It's like a windshield wiper. Back and forth. Leaning forward. Coming across. Opening, shifting, forward, across. So This is very imperative to the hip health, the hip mobility, and just the fascial lines that run through and across your hip capsule, your pelvic bone. There's a ton of muscles. It's the middle between your upper and lower half of your body. So you've got your superficial front line, your deep front line, your superficial back line, your spiral line, your functional line, your lateral line. Literally every line, except for your arms, runs across your hips. So it's imperative that we start getting hip mobility and femur movement in that hip socket in different angles. Okay, we want to start to unglue and be able to work movement of the joint capsule, not just worry about strength in the muscle or flexibility through the muscular system. Musculoskeletal system work, but the neuromyofascial systems work, the fascial muscular systems work. Everything's working together. So we have to address the body in its entirety and not focus solely on opening the hamstrings or opening the quads, but looking at the whole picture of the hamstrings lie in this superficial back line, or your hip flexors lie in the superficial front line, and they work their way into the deeper front net, and they work their way into the lateral net. So we're going to look at the different components of movement. Movement is medicine. So the more your body moves, the better you're going to start to feel, because you're opening up your movement patterns that you're supposed to have. I'll see you in your next video, guys.